Hi, guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I always like to get into my disclaimer and reminder that there's no absolutes in medicine. We treat on a patient by patient basis, so any of the questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AANP exam. Now, any of the videos that you may see on here, if they are teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states the nurse practitioner is assessing a patient today with a history of congestive heart failure. Upon examination, the nurse practitioner notes that the patient is experiencing shortness of breath with any exertion and noted orthopnea. Based on these findings, how should the nurse practitioner classify them based upon NYHA classifications for heart failure? Is it A, class 1, B, class 2, C, class 3, or D, class 4? Take a moment and tell me what you got in the comments. All right, so I always recommend reading the stem of the question first so that you can ensure you're answering what is being asked. So the stem of the question here states, based on these findings, how should the nurse practitioner classify them based upon the NYHA classifications for heart failure? So then you need to go back and see how the patient is presenting. The patient is having shortness of breath, dyspnea on exertion anytime they exert themselves, as well as orthopnea. And I always tell y'all when things are in ranges, look at the full picture. Know the lowest range as well as the highest range, and the rest will fall in between. So the lowest class 1 of the NYHA classification for heart failure, there's no symptoms. Yes, they have the diagnosis of heart failure, but they deny any shortness of breath or any limitations with physical activity. Whereas on the opposite end, class 4, the highest stage, they have symptoms all the time. So they have dyspnea on exertion with any exertion. They're and even at rest. So that's where orthopnea is. Orthopnea meaning when they lie flat, they feel winded or feel as though they're drowning. Those are those patients that need to be propped up, or they sleep in a recliner, or that they sleep on 2 or 3 pillows and able to get rest at night. Okay. So here, the best answer is D, class 4. All right, question number 2. A patient presents to the office today for follow-up. He presents with a glucose log. Upon review of the glucose log, it's noted over the past 2.5 weeks, his glucose in the mornings are ranging in the 200s to 300s, and in the evening, his glucose is in the 40s. Based on these findings, what is the best diagnosis at this time? Is it A, dawn phenomenon, B, the Samogi effect, C, nothing the glucose requires reassessment, or D, hypoglycemia? Take a moment and tell me what you got in the comments. All right, so stem of the question here states, based on these findings, what is the best diagnosis at this time? So, I always tell you, if it's asking for a diagnosis, you need to run it back and see what the assessment findings are, right? So this patient came in for follow-up, came and brought his glucose log. That's perfect. But as the nurse practitioner is reviewing the glucose log over the past 2.5 weeks on the log, there's noted morning hyperglycemia and evening hypoglycemia. So when you think of that, you should initially think of B, Samogi effect. Remember, Samogi effect, they may present with these early morning hyperglycemic readings, but it's in effect because of the nighttime or evening hypoglycemia. Because what happens is there's a rebound effect. So as the blood sugars are lower in the evening, the body is trying to compensate, and there's a rebound effect, which causes it to have a early morning hyperglycemia. So that's why we always want to check if they come in and they're telling you they're having those early morning readings of elevated blood sugar levels. You want to check the morning and the evening readings so that you can gauge and see if it's dawn phenomenon, if it's emoji effect, or if it's an isolated event. So you need to be able to determine this and track how they are reading on a daily basis, morning and evening. Okay. So again, best answer is B, emoji effect. And then question number 3, the nurse practitioner and NP student are discussing subclinical hyperthyroidism. What lab values are an appropriate representation of subclinical hyperthyroidism? Is it A, the TSH is elevated and T3 and T4 are low? Is it B, TSH is low and T3 and T4 are low? C, the TSH is elevated and the T3 and T4 are normal? Or D, the TSH is low and the T3 and T4 are normal? Take a moment and tell me what you got. All right, so stem of the question here states, what lab values are an appropriate representation of subclinical hyperthyroidism? So remembering what is subclinical hyperthyroidism, because see here, this stem of the question tells you truly what is being asked here. So we know we have hypothyroidism and hyperthyroidism, and then you have those subclinical ranges. And I always tell everybody to think of subclinical about like how we see pre-hypertension, pre-diabetes. It's that previous phase where it's not all the way to that complete diagnosis of the hyperthyroidism. So we know with hyperthyroidism, I always tell you that the TSH is going to be opposite of what the term is. So the TSH would be low, but then the T3 and T4 would be high based off of the terms, right? For just standard hyperthyroidism. Well, with subclinical hyperthyroidism, the TSH will be low still, but the T3 and T4 will be normal. Okay. And same thing for hypothyroidism, it will be the opposite, right? So the TSH will be elevated, but the T3 and T4 will be normal. So here, the best answer is D. The TSH is low, and the T3 and T4 are normal. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure to meet me back here. If you need any of the resources that I offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number 1 at gmail.com. The things that I do offer is the review book, and it is in an ebook option or paperback, and both are linked in the bio of this channel. If you're looking for an independent review where you can do it self-paced, watching videos per system, that is also linked in the bio of this channel. The 5-week up and coming intensive group review will be in September. So the registration links will be coming out within the upcoming week. And then lastly, if you're looking to book a one-on-one session, I always say reach out because it is based off of what you truly need, since they are customized courses and sessions. So you can book a session for a weakness. So you can book for 1 to 2 weaknesses per session. You can book an exam readiness assessment, or you can book the custom plan where you're provided a pretest to gauge where you are. And based off of the timeline that you're looking to review, I structure a study plan for that duration and work alongside with you during that time frame to take you to a successful exam attempt. Okay. So again, if you need any of those resources, feel free to reach out to the nursing studio, but make sure to meet me back here. Happy studying. Bye, y'all.